Well, our healthcare workers are overworked and they are quickly burning out under the pressure of overwhelmed hospitals. Yet close to 300 medical interns are still waiting for placement. So what's the hold-up when there's clearly a shortage of hospital staff to battle the pandemic? Well, we hear now from Dr. Angelique Coetzee, the chairperson of the South African Medical Association. Doctor, thank you so much for joining us. 288 medical interns require placement. What's the problem? Why the delay?
Thank you so much, Annika, for asking us our opinion. So yeah, it is the old story, the same story of inefficiency. So the beginning of the year, they knew that 288 students would be eligible to start their internship in July. That's actually tomorrow. So money was made available as far as SAMA could have established. Unfortunately, budget cuts came into play, and then, as normally, what would you do? There was money for the salaries. Remember, the money that we are talking about is the monthly salary of these interns. So the salaries was being used for something else. Now we need to get these doctors into the system, and all of a sudden, there's no money to pay them. So of the 288, we have at least money for 133. Unfortunately, the 133 doctors don't know who they are as yet. So there's 150 doctors still outstanding that we need funding, 155, sorry, that still need funding. So there was a high delegation meeting yesterday with National Department of Health, or between National Department of Health and Treasury, National Treasury, where it seems to us that they came to an agreement that they will make the monies available. To tell you the truth, they don't have a choice. This is a regulation, an act. These young doctors they have to do their internship. It's compulsory. And government needs to pay for it. It's compulsory, because if they don't do this, they can't become or can't get a certificate from the HPCSA to practice and go into their community service year, or thereafter either specializing or go into private practice. So it's a huge problem that we are currently encountering. And this is nonsense, because it's every year the same story. It's not as if they don't know how many students will end up being interns. It's a known fact since they enrolled in their first year. So same story, inefficiencies, don't know where the money went to.
I mean, Treasury during budget did say that for 2021 it has a 12 billion rand contingency reserve, which was going to be used for vaccination, logistics and COVID-19 related issues. Could any of this money not be diverted? Is that something you've discussed with the Health Department or Treasury?
So we haven't discussed that yet, because yesterday's high-level meeting was between National and Treasury. So hopefully they are listening and using some of those monies. You know what? At the end of the day, it doesn't actually matter where they get the money from. They need to get that. They need to give these monies to these young doctors. If these young doctors are not being placed tomorrow, I think it would be only fair from SAMA side and other organizations, especially these young doctors as well, so for us to make a huge noise and take them to court. You know, at some stage one needs to start to be more active and bring the law in. One way or another, it seems to be that is the only way anything happens. But it is so unnecessary. And the other thing that is not acceptable is, remember, these doctors would hopefully know by the end of today that they need to start tomorrow. If I am studying, let's say I'm currently in Pretoria, and by this afternoon I'm hearing that I need to be in Cape Town tomorrow. How do you want me to get to Cape Town tomorrow? So there must be leniency, and they must get paid for day one and day two, that they're not there yet, because it's no fault of them. It's a system. And the system needs to take responsibility for this. Also remember, these doctors that need to go to another place, wherever they are placed, they still need to reallocate with all their furniture, with their wife, with their children, whatever, you know. It's not just a person. It's a whole logistical thing around it. And these youngsters are very young. So, you know, they're expected to do medicine, to do something good for the country, and to start your career like this. It's unacceptable.
They've worked so hard and we need their help so badly right now. They could be so well utilized, even going to field hospitals in Gauteng. It would make such a difference. Let's hope this gets resolved. We will keep in touch with you, Dr. Angelique Coetzee from the South African Medical Association. Thank you for your time.